Hello, Colin Hung here for Healthcare IT Today, and I am here in Toronto for the OntarioMD Educates conference. This is a conference that brings together physicians, policymakers, and vendors who are working to increase the adoption of digital health solutions at physician practices in the province. I have always found this conference to be one of the best ways to get a sense of what is happening in the ambulatory side of Canadian healthcare. It was not surprising that the big topic of discussion here at this year's conference was AI. In fact, the conference kicked off with a keynote and a panel discussion on the impact AI is having and will have on the practice of medicine. Now, there were two really great quotes from the panel that I want to highlight. The first came from the moderator, Will Falk. He said, right now, AI is nothing more than a point solution. It complements the work that people are doing in healthcare, but it does not replace anybody. And I really think he was spot on with that comment. And in fact, it should be on a plaque at a doctor's office. AI complements, but does not replace physicians. Rosemary Lal, who is a physician peer leader at OntarioMD, also had a great comment about AI. She said, AI scribes are not decision support tools. I think what she was suggesting is that AI is still new in healthcare, and they should not be used for making treatment decisions, at least treatment decisions unmonitored. Now, right before this conference started, OntarioMD released the results of the in-depth study that they did on AI scribes. If you remember, back in April, OntarioMD CEO Rob Fox spoke to us about how this study was meant to cut through the AI hype to determine if AI scribes really are as good as vendors claim them to be. Well, after reading through the study, let me tell you, I haven't seen a better endorsement for the use of AI in healthcare. The study results were glowing. In fact, the study showed that docs are spending about 70 to 90% less time on paperwork with AI scribes. That is just mind-boggling. And it confirms the numbers that vendors have been touting all this time. Here's a snippet of my conversations with Rob Fox and Chris Sulway, who is the Chief of Strategy at OntarioMD, about the details of that study.
In fact, the whole purpose of the study was to remove the rhetoric. So people had started to dabble in AI scribe a long time ago, and they started talking about how amazing this technology is and the opportunities it provides for patient care and practice optimization. But we wanted to put some rigor to the process and do an evaluation that had a full research methodology to it, that had biases removed, that it was a great sample of physicians. And this report was absolutely in line with it and actually validated what we thought was going to happen. I think that it's going to get better from here, right? Because we're at a starting point of this innovation and how it's being rolled out and the development of these tools. But as they progress and they mature, we're going to start to see more functionality that come out of these opportunities, not only with AI Scribe, but by linking it to other technologies that are already in practice or are being developed now. So I think that we have a huge upside in terms of how AI Scribe is the starting point of technology providing value to physicians and patients.
The results, as you suggested, were quite something. You obviously see the impact it has on time savings, but I think the parts that I really enjoyed to hear about was the impact it had on patient care. You had patients and physicians saying it allowed a more deeper conversation. Those physicians weren't having to multitask while they were trying to have that interaction, which I hear them say that it also impacted on their cognitive load. They weren't having to multitask all day, take in different bits of information, and they leave the day in less burnt out, which I think is a really positive thing when you hear that from a technology product.
Yeah. Now, on a related note, Nuance DAX is coming to Canada. And they are not just riding the epic wave that is sweeping across this country. The team at Microsoft are investing time and effort to increase the adoption of AI tools in healthcare. I caught up with the Nuance team, who confirmed for me that they are growing their presence in Canada.
I'm Paul Pustai. I'm with Nuance Microsoft Canada. Super excited to be here at the OntarioMD conference. I'm joined by
Duncan Salt, also with Microsoft, came through the Nuance acquisition into Microsoft. So,
yeah, and we're really we're excited about a lot of the agenda here today at OntarioMD is about how ambient scribe is really helping physicians, save time, reduce that cognitive burden, be present when they're talking with patients, and we're really seeing it make a huge impact in the healthcare system. DAX is going to be a fully Canadian available solution coming early next year. It's being piloted today at the Ottawa Hospital, Hamilton Health Sciences, UHN, Holland Bloorview, and we've got lots of other folks that want to start taking advantage and leveraging this technology, because ultimately we think it's going to lead to much better patient care.
As always, I made time to tour the exhibit hall here at OntarioMD Educates, and there were a lot of really great companies showcasing their products. Here are just a few of the interesting ones that I spoke to.
Hi, my name is Mahshid Yasai. I'm the co-founder and CEO of Tally AI. It's very fun to be here, and we get to see a lot of our clinicians that are using the product. They come to say hi and tell us how they're saving almost 2 hours a day, what they're doing with those extra 2 hours a day. We get to see our partners. It's been very good so far. You can go to tally.ai, the URL, and then you will be able to download Tally and try it, or just learn about the solution end to end.
Hi, I'm Michael Miller. I'm the CEO and founder of Verito Health. I'm excited to be here at the OntarioMD conference. We're actually announcing the release of our Verito Connect application that works with family health teams and physicians to go through their EMR, the longitudinal historical records of all your patients, and actually create digital twins from that using AI technology. By creating digital twins, we give the power for them to be able to do population queries, quickly identify cohorts that they need to address, and also understand billing gaps and service gaps that they have inside the population without the burden of doing long chart reviews and administrative activities. You can find us at verito.health online.
Hi, my name is Daniela Gotera. I work for Mutual Health. I'm the Customer Success Manager. We are today in the OntarioMD conference on Toronto. We are so excited to be here, and we can have the opportunity to talk with different users, different clinicians, and talk a little bit about auto forms, which is something that will be available in the following months. With this you can use it to populate different forms like WSIB, blood work requisition, ultrasound requisition, and so many others that you can think of. We also have cool integrations with EMRs like Oscar, Epic, PS Suite, Cerner, and now in the following months we will have integration with Accuro. It's great to be here. Thank you so much. You can, if you need more information about us, you can contact us at mutualhealth.com, and we will be happy to help you.
Hi, I'm Hamim, account executive at Felix AI. Very excited to be here at OntarioMD today. A lot of people have been asking about our AI-powered fax inbox. This inbox actually uses AI to read, extract, tag, and upload fax documents into the patient chart and provider inbox into the EMR, with or without staff intervention. For more information, please visit our website, felix.ai, and we'd love to host you for a demo.
Overall, this conference has been very educational. In addition to AI, there were some great discussions and presentations on cybersecurity, interoperability, Ontario health teams, and even remote patient monitoring. So what are my key takeaways? Well, first, I was surprised to learn that OntarioMD has plans to certify AI vendors. They want to do this to protect Canadian doctors from fly-by-night vendors who have untested AI solutions in healthcare. I will definitely be keeping my eye on this and will report back when those certification details become public. My second takeaway is that entrepreneurs are jumping full force on the AI bandwagon here in Canada. There were a lot more companies here in the exhibit hall and on the show floor just touting their AI scribes and AI assistant apps. It will be very interesting to watch and see how many of those make the leap from being a standalone app to one that is fully integrated and frankly embraced by EHR platforms here in Canada. My final takeaway is how excited the physicians were at this conference. Every physician I met was optimistic about the future of their practice. Yes, there are challenges and issues that need to be addressed, of course there are. But there wasn't the same level of frustration and gloom that I sensed a few years ago at this very same conference. The physicians who had the biggest smiles on their faces were the ones who had embraced AI scribes. And I don't think that's just a coincidence. I want to thank the team here at OntarioMD for inviting me to come down to their conference. It's always a lot of fun to be at a healthcare show so close to home. I enjoyed being able to connect with physicians and IT folks who are really pushing for the adoption of new technologies in Canadian healthcare. I cannot wait for next year's conference. And hey, if you enjoyed this video as much as I enjoyed being part of it, please like and subscribe. Also, head on over to healthcareiTtoday.com where you can find more great content like this. I'm Colin Hung here in Toronto, Ontario. Thanks for being here, and I'll catch you on the next video.